Hello. As you know from other modules on this website, I'm Alexander Blunt. I'm a professor of clinical psychology at Antioch University, New England, and a professor of family medicine and psychiatry at the University of Massachusetts Medical School. I want to introduce you to information on the New Hampshire Primary Care Behavioral Health Workforce website. This is information about the roles of team members in primary care that contribute to the behavioral health of patients. The jobs I'll talk about are ones that are presently being done in the federally qualified health centers and the rural health centers in New Hampshire, but they also represent roles in primary care in most parts of the country. All of the job roles we will mention require skill at relating to patients and at working as part of a team in primary care. Here is the website. It is nhpcbhworkforce.org. The website is supported by the Endowment for Health in New Hampshire. It was created to provide resources to help people understand what the common roles in primary care are, to create pathways for training so that workers can build their skills for higher paying positions with more responsibility without having to leave their jobs in primary care, and to help employers in primary care to set up career ladders so that employees who are already working in their health centers can become trained and credentialed to provide behavioral health services. This avoids the much more difficult task of recruiting professionals from out of the area to come to where the jobs are unfilled. Looking at the first page, we're going to go to the Career tab. I'm going to start on the left. We're talking about the usual behavioral health clinician roles in primary care and how people prepare for those roles. We've talked in earlier student modules about what the behavioral health need is in primary care and how behavioral health clinicians make it possible for practices to address those needs. Let's start here with the process of becoming one of those behavioral health clinicians. A behavioral health clinician, as you remember, is someone who is licensed to be a provider of behavioral health services in a state. In general, these people train as mental health clinicians, but they need additional training to make the transition to working in primary care. We've talked in other modules about how different the primary care field is from the mental health field that most graduate programs train clinicians to work in, how there are different cultures, different rules about confidentiality, and different relationships between clinicians. Patients bring many types of needs to primary care, which requires that professionals and staff work as a team and share information to help the patient. In mental health settings, services are more individually focused on the therapeutic relationship between one clinician and one client, rather than between one patient and their health team. This is how people usually prepare to provide behavioral health services in primary care. We're focused on master's level training because the leap to doctoral level training is much harder for someone who needs to keep a full-time job while they train. Master's level training includes marriage and family counseling, clinical social work, and licensed mental health counseling. In primary care, these clinicians should also be trained to serve the substance abuse needs of the patients. The road to being a behavioral health clinician begins with a bachelor's degree. Commonly, people also have some type of work experience before they start a master's program, though this isn't required. Very often, they get experience in some job that involves helping people and get a little perspective on how complicated, challenging, and rewarding helping people can be. For people training to be behavioral health clinicians, the easiest way to prepare is to follow the left-hand track. Their graduate program should give them an opportunity for an experience as an intern or a practicum student, some kind of significant placement within primary care. In this placement, they spend time being supervised in the role of behavioral health clinician. A lot of master's programs don't consider that they are preparing their students to work in primary care. When we surveyed all the programs in New Hampshire, for instance, that prepare master's level clinicians, only one expected that some of their graduates would ultimately work in primary care. That was in contrast to when we talked with the primary care sites. They said yes, they had employees with master's degrees from academic programs in New Hampshire. So the academic program staff members were less informed about an important type of jobs for their graduates. It may be that this will change by the time you see this video. If you are someone who's picking a master's program, you should ask them if they have the ability to place their trainees in experiential sites in primary care. If they say no, you might want to use that criteria for choosing between mental health graduate programs. In our program in clinical psychology at Antioch University, we have a special major area of study in health psychology. It's particularly focused on primary care. We have a pathway all worked out. A training program doesn't have to have coursework in primary care behavioral health, though it helps. But they should have the ability to place someone in primary care. That will generally be at least the minimum experience someone needs to make a successful adjustment to primary care as a professional. The other pathway on the right is post-degree training. There are several programs that you can take online that are designed specifically to help people make the transition between their mental health training and becoming a behavioral health clinician in primary care. On our website, this post-degree training in primary care behavioral health is a live link to another part of the site that lists training programs you might want to consider and offers a description of the advantages and disadvantages of each one. But these two pathways are not coming close to meeting the need for behavioral health clinicians as integrated primary care expands across the nation. In many states, as well as nationally, the workforce crisis is well recognized. On one hand, if you're a trained worker, that's good for you because you're going to get a job. On the other hand, if these are the only pathways, it's going to take a long time to catch up. And primary care sites that are in rural or underserved areas may have difficulty attracting qualified behavioral health clinicians. So let's go to the other side of these two graphics. This is much more complex on the right, and it comes with a different set of understandings about what the possibilities are. This is based on what we learned as we assessed the behavioral health workforce in New Hampshire. And again, this is true in many other states as well. As behavioral health becomes part of the services in primary care, more of the roles that aren't specifically behavioral health clinicians start to have significant behavioral health aspects to them. Having behavioral health clinicians in a practice means that there's much more attention to behavioral issues of patients. Screening for behavioral health problems like depression or anxiety or substance abuse is likely to be instituted. Discussion of the behavioral health needs of patients becomes much more common in the clinical exchange between providers in the practice. In the graphic, the roles in the middle, the ones that we call care enhancers, use behavioral health skills in their work and need consultation and supervision from trained behavioral health clinicians, whether they are psychiatrists or non-medical behavioral health clinicians. So a behavioral health clinician who joins a practice and provides therapeutic interventions and assessments for patients is likely to be also used as a consultant or supervisor on behavioral health issues for physicians or care enhancers. These middle roles gradually become more important at building connections to patients or motivating patients in relation to their health behavior. The career ladder that we're describing is similar to one that's existed in the field of nursing for some time. Nursing has worked out a ladder through which people can enter a setting, for example, as a licensed practical nurse, and while they're still on the job, they can get training to be a registered nurse or even a nurse practitioner. The advantage is that people don't have to leave their job or take on significant debt by giving up their check for a year or 2 or 3. It takes longer to get a degree or a certificate while working full-time. But it can also yield more seasoned and competent workers. These are jobs that are full of learning opportunities. And if there is supervision or consultation about how to help patients with more complicated situations, coming to work can be the most valuable learning experience that people go through. People can gradually grow in responsibility and in job level, including increases in payment and in job title as they get education and practice every day in primary care. For employers, this is particularly valuable because these workers have already chosen to live in the area of the practice and have committed time to the patients and the other staff that they will be working with in the future. Employers can literally grow their own workforce Consider the possibility that an employee enters the practice as a community health worker, or a medical interpreter, or a medical assistant. On our website, they can click on these boxes and learn about each position, the training that's required, and some general idea of what the salary is likely to be. If someone is already in one of the entry positions, they can learn about the care enhancer roles and discuss with their employer which training could be most useful in their current primary care site. People in one of the care enhancer positions can click to find lists of online master's degree programs that they can use to get the training and the credential they need to move up to a licensed behavioral health clinician position. We use the term care enhancer as a general term for this group of positions because there is no standardization about the job requirements of a particular job title across different practices. We put in substance abuse counselor in the behavioral health clinician roles, though we recommend that it is better to have this role filled by someone trained as a clinical social worker or marriage and family therapist or psychologist or mental health counselor who gets training in substance abuse. Having two different people in a site, one who is a behavioral health clinician doing mental health care and the other doing substance abuse care, fragments care even though you have two new people there. There's also a problem when one staff member is designated as a provider of substance abuse services by their job title. At that point, they are not allowed to talk to other staff members in a medical setting about the substance abuse diagnoses or treatment of a patient without an extra signature from the patient allowing that communication. On the other hand, if a person who is a general behavioral health clinician provides substance abuse services as part of the needs of a particular patient, the rule against sharing communication with the other team members doesn't apply. In order to get the benefit of growing their own behavioral health workforce, an employer and the health system are going to have to create flexibility so that people can take extra training while they're doing their jobs. Some employers tend to think of staff member getting training for a new position as being something that only benefits the staff member. If you look at it from the perspective of growing the future behavioral health workforce for the practice or for the health system, the idea of flexibility starts to seem more attractive from the employer's point of view. Another important plus about creating a career ladder is that it makes diversity among the staff much easier to attain. It's much easier to find medical assistants or community health workers or medical interpreters from diverse populations than to find licensed professionals from those populations. Imagine, for instance, that you lived in a community with a fairly new population of Somali refugees. It could be a population that required a good deal of behavioral health skill to be able to engage them and to meet their health needs. It's much more likely that a practice could find a Somali medical assistant or medical interpreter who could develop into a behavioral health clinician over time than that they would find a Somali behavioral health clinician who wanted to locate to that community. The career ladder makes it possible for sites to deliver on the commitment to diversity that we talk about all the time, but often don't make very much progress on. So that's the introduction to the graphics on our website. If you're an employer, I hope you'll consider these approaches as a way of helping to meet your own need for behavioral health clinicians in primary care. If you're a student or a person considering a career at some level in primary care, I hope the resources on the website will make it much easier for you to plan a pathway for yourself. In the long run, we're hoping that all of this might lead to more people becoming interested in working in primary care and to the growth of a competent, patient-centered, team-oriented workforce. Thank you very much.